Hello everyone, welcome to Boundless Dentistry. Today in our video we'll talk about Introduction to Dental Anatomy Part 2. In the previous video, in Part 1, we talked mainly about what is dental anatomy. Furthermore, we talked about the numbering system that we use to denote each tooth that is present in the oral cavity. And then finally we talked about different types of teeth that are present in the oral cavity, such as the primary teeth and the permanent teeth. So if you wanna go back to the previous video so that you can understand what we are doing in this video, so you can check the video that is the link of the video that is given in the description. So let's begin. Okay, so first I'm going to talk about the basic structure of a tooth. What are the different parts of a tooth? So let's start. Now let's suppose this is a tooth. I'm going to draw a tooth, and this is a maxillary tooth. Okay, so the tooth is divided into two parts. We have the crown portion of a tooth and we have the root. So this portion that is normally visible in the oral cavity is known as the crown. Okay, and now this part of the tooth that is not normally visible in the oral cavity, unless there is some pathology that we will discuss in our future video, this is known as the root. So the tooth is divided into two parts. We have the crown portion of the tooth, and then we have the root part of the tooth. Now there are certain definitions that you have to know and that are pretty much required when you are studying dental anatomy. So let's talk about that. Okay, now these are the four these are the four basic terms that you have to know when you are studying dental anatomy. So I'm going to talk about it one by one. So let me just draw a structure of a tooth. This is just a rough diagram of a tooth, mainly it's a mandibular tooth. So let's talk about this. First I'll tell you what is an anatomic crown. Anatomic crown is basically the entire length of a crown, starting from the tip of the crown all the way up till the cemento enamel junction. Now cemento enamel junction is basically a point where the outermost layer of an enamel joins the cementum. I'll talk about this in much more detail in future videos, but just remember for right now that there is a junction present here, and from the tip of the crown till the cemento enamel junction, which is this junction, this is known as CEJ, the cemento enamel junction. From the tip of the crown right here up till the cemento enamel junction, we have the anatomic crown. Okay, now talking about what's a clinical crown. Clinical crown, simply put, is the part of the crown that is visible in the oral cavity. Normally this CEJ part is not visible in the oral cavity. The gingiva, the soft tissue that covers the crown, it's slightly placed above this CEJ. And if due to some pathology, for example periodontitis, we will discuss what's periodontitis in future. If somehow a patient suffers from periodontitis, so the gingiva moves apically, thereby exposing the CEJ. Now when the CEJ is exposed, the crown length is more visible in the oral cavity. So normally in a healthy individual, the CEJ is not visible in the oral cavity. So clinical crown is that part of the crown that is visible in the oral cavity, simply. Okay, now talking about what's an anatomic root. Anatomic root is basically the entire length of the root, starting from CEJ all the way till the tip of the root. The tip of the root, this part, is known as the apex, the terminating point. Now from this CEJ all the way till the apex, this is the anatomic root. The entire length of the root is known as the anatomic root. Now lastly, talking about what's a clinical root. Clinical root is basically any part of the root that is visible in the oral cavity. Like for example, like I talked before, if a patient is suffering from periodontitis, the gingiva moves apically, like gingiva starts to move downwards, like it's normally attached, like I said, above the CEJ. Here, this is the CEJ. Normally gingiva is present above the CEJ, and when the gingiva recedes below and below, And for example, the gingiva is now present as this dotted at this dotted level. Like I've drawn this. Now you can see this part, this little part that is now visible is the part of the root that is visible in the oral cavity. This is known as clinical root. In a normal individual, the clinical root is not visible in the oral cavity. That's what is a healthy tooth. And if somehow it's due to any pathology, the root is now visible in the oral cavity, it's not good. So that is known as the clinical root. So these are the four basic terminologies that you have to know when you are studying a tooth. Okay, now talking about the structures that are present in the tooth, basically there are three structures that are present in the tooth. The outermost layer that you can see here with the black is known as enamel. Enamel is the outermost layer of a tooth. Now note, enamel only covers the crown portion of the tooth. There is no enamel in the root part of the tooth. In the root, the outermost layer of the root is covered by cementum. We'll talk about that in a short time. Now the second layer that is present in the tooth, that is indeed covered by the enamel, is known as dentine. This is the dentine part of the tooth. And finally, the innermost layer of the tooth, or the innermost structure of the tooth, is called as pulp. Now pulp is the part of the tooth that is alive. The rest of the enamel and dentine, they don't have any they are not they are more of like a dead structure. Only the pulp is the living structure of the tooth that supports the tooth and provides nutrition and sensory function and many more functions. We'll discuss that in our future videos. Talking about the last layer of the tooth, that is the cementum. Cementum is just a thin layer, as you can see here. I will draw it out for you. It is just a thin layer, very very thin layer like this, that covers the root of the tooth. This is the cementum. It's a thin layer, it's not that thick of layer. And now note, the part where enamel meets cementum, this part is known as CEJ, that is known as cemento enamel junction. Now there are also different varieties of this cemento enamel junction. We will talk about that, don't worry. So this was about the entire structure of a tooth, the basic layers that are present in the tooth. Okay, now talking about the surfaces of a tooth, there are different surfaces of a tooth. Like if you view it from the front, it's called something else. If you view it from the back while placing a dental mirror inside, it's something else. Then from both sides, there are different terminologies that are used when we are talking about surfaces of a tooth. So let's start that. First, I'm gonna draw a little structure of a tooth. Let's suppose this is a incisor. Okay. Now when you are viewing the incisor from the front, that view, like this view, when you're viewing it from the front, this view is called as labial view. Labial view or labial surface. This is when you're viewing the tooth from the front. This is known as the labial surface. Okay. Okay, now talking about the mesial and the distal surfaces of the tooth. For that you have to know what's a midline. Now for example, there are two central incisor present here. Okay, these are the maxillary central incisor. Now note, in between them there is a imaginary line which we call as the midline. Now midline is basically the part where the dental arch is divided into two, both arch having equal number of teeth. So the surface of the tooth that is closer to the midline, this midline. So for example, if we are talking about this incisor, now this surface which is closer to the midline is known as the mesial surface. Mesial, you can remember mesial by being closer to the midline, M and M. So the surface of the tooth that is closer to the midline is known as the mesial surface. And now talking about this surface, now this surface is away from this midline. You can see how away this is from the midline. So the surface of the tooth that is away from the midline is known as the distal surface. or distal aspect, you can call it. Both works fine. So mesial surface of a tooth is that surface which is closer to the midline. It can be any tooth. For example, it can even be molar. Molar, if I draw out a molar, for example, there's a midline over here, and a molar is a tooth that is present at the posterior side of the tooth. So the part of the molar that is closer to the midline, that is this part, is the mesial surface, and the distal surface would be this surface which I have drawn with green, that is away from the midline. So we have talked about what's the labial surface. Labial surface is that part of the tooth. This is the labial surface, that is you can see from front, that is visible. Mesial surface is that surface of the tooth that is closer to the midline, and distal surface is that part of the tooth that is away from the midline. Okay. Now, lastly, talking about what's the lingual surface. Lingual surface is that surface, like for example, if you view a tooth from the back of the mouth. Now, you cannot basically see from your eyes the back of the mouth, so you use a dental mirror. Dental mirror is basically a small instrument like this. It has a tooth and it has a shank like this. You place it in the oral cavity, and then you view the tooth from the back side so that you can see the lingual side or the palatal side. I will tell you what's a palatal side. So the tooth, when you are viewing it from the back side, is known as the lingual view. For example, if you have a central incisor like that and you are viewing it from the back, now from the back you can call this view as lingual view. Now there are certain differences when you are calling these terminologies for anterior and posterior teeth and for maxillary and mandibular teeth. So let's talk about that. Now, if you're talking about the mandibular anterior teeth, so you normally use the term for the front view as labial. This is for, I'll call this mand, means mandibular, and mandibular ant means mandibular anteriors. And same, if you use the labial term, you can, for the posterior teeth, you use the term as buccal surface for mandibular posterior teeth. Posterior teeth basically includes the molars and premolars, and mandibular anteriors. Anterior teeth basically are your incisors. So these are the two different variation of the terminologies, because it's basically related to the aspect of the thing. Like labial means lips, so anterior teeth, the lips are closer to it, so you use the term as labial view. And for mandibular posterior teeth, it's in direct in contact with the buccal mucosa, as the cheeks that you can feel. It's known as the buccal view. So it's the different variation of the tooth. Okay. Now another variation for same mandibular teeth, for the view which we are using the dental mirror to view from the back side. For mandibular teeth, we use the term lingual for both the mandibular anteriors as well as mandibular posterior. Now, why do we call it lingual view? We call it as a lingual view because it's directly facing the tongue. Like for example, there are different teeth that are present in the oral cavity, and the tongue is placed like here. Okay, so this due to this tongue, we call it as a lingual view. Okay, now talking about the maxillary teeth. For the maxillary teeth, the terminologies is pretty much the same for the labial and the buccal view. The only difference is because the maxillary teeth are facing the palate, so it's called as palatal view or palatal surface. Both works fine, because as the maxillary teeth are present, they are facing this hard shell structure which is the palate. So because they are facing the palate, it's known as the palatal view. Okay, now talking about the last surface that is present in the oral cavity of a tooth, that is the top part when you view the tooth from the above. Now there are two terminologies. We have the incisal surface and then we have occlusal. Incisal is basically used for anterior teeth, anteriors, and occlusal view we use for posterior teeth. Now, for example, if you're viewing a tooth from above, like for example, an incisor is a small tooth, that is, you are viewing from the top view, it's known as incisor. And if you, for example, premolar or molar, it's a big tooth as compared to incisor. So if you are calling out the top part of the tooth for a posterior tooth, it will be called as occlusal view. And if you are using the term for anterior, we use the term incisal. So that was all about surfaces of a tooth. Okay, now we'll talk about the different terminologies that are used in dental anatomy. Some of them you can see that these are of much important as compared to other which are not that important, but you should know these basic terminologies. First, we'll talk about what's a tubercle. Tubercle, if you simply put, is a small elevation of some part of the crown that is formed due to excess deposition of enamel. So, for example, if you have a canine. Okay, this is a canine tooth and we have the root over here. Now sometimes on canine there is an extra formation of enamel over here. It does occur in a canine tooth. So the small elevation that you can see here is known as tubercle, excess deposition of enamel formation. Basically, there's not much pathology that occurs with it, but this tubercle can be fractured, which can in future lead to exposure of pulp, thereby requiring root canal treatment. Next, talking about cingulum. Cingulum is present on the anterior tooth, and if you want to feel the cingulum more prominently, it's mostly felt on canine tooth. So it's basically present on the lingual part of a tooth, like over here. It's present. It basically occupies the cervical third of our tooth. We'll talk about different parts of the tooth, like what's the cervical third, middle third. I'll get to that. But for now, just remember, cingulum is in it's a elevation that is present in the lingual surface of a tooth, and it can be felt more prominently in the cingulum. Now talking about a ridge. Now what is a ridge? The definition of ridge is a linear elevation that is present on any tooth surface, for example the buccal surface, mesial surface, or a distal surface. Now these are basically slight elevation, like for example on a buccal surface of the tooth you can see these like elevations. These are slight elevations that are present on the any surface of a tooth. These are slight elevations. Okay, so these are linear elevations that are present on the surface of a tooth, and it is named according to the surface that is present on. Like it can be called as buccal ridge, lingual ridge, and it can be called as incisal ridge if it's present on an incisor tooth. Now talking about fossa. Fossa is defined as irregular depression on concavity. Fossas are more prominently seen in posterior teeth, although they are also present in the incisal teeth, but the posterior teeth they are more prominently present. So in this picture you can see this is an occlusal view of molar, and fossas are something like this. They are present like these depressions, irregular depressions or concavities that are present, and they are also named according to their location where they are present. For example, it can be a mesial fossa or a distal fossa. It can be also called as triangular fossa. There are different terms that are used, and if this fossa is present on the lingual surface of an incisor, it's known as a lingual fossa. Now talking about a groove is a shallow line that is present in the parts of a tooth, for example a crown and a root. So for example there is a groove that is present between the buccal and the mesial surface of the tooth. This is called as mesiobuccal groove. So these are just lines that are present between the primary parts of the tooth. Now talking about pits. Pits are basically they are called as pinpoint depressions where they are present between developmental grooves, a junction or development groove. So for example, there is a developmental groove that is present over here. Now at this point, there is a pinpoint depression. Now this pinpoint depression is called as pit, and it can be also named according to its location. For example, in this case, this pit is present in center, so we can call this as central pits. Again, these pits are most commonly found on the posterior teeth. They also be found in anteriors, but not that quite frequently as compared to the posterior teeth. Now the last definition that is here is the lobe. Lobe is one of the primary sections of formation and developmental of a crown. Now these are basically that part which take part in development of crown. Like for example, if I talk about mamelons, mamelons have slight elevations that are present in the newly erupted tooth. As the teeth come into function, they simply wear off, leaving a flat incisal edge. Mamelons are mostly present in the anterior. So mamelons are something like this. So this structure of a tooth is called as lobe. Even the crown can be called as a lobe because it is a part of formation of the entire tooth. Okay, now talking about divisions of a tooth. Now, tooth can be divided into various portions that aid us to define its location. So, if you talk about crown, crown can be divided horizontally as well as vertically. So, first talking about this horizontal division, we divide the tooth like this and this. This part of the tooth in an incisor is called as incisal third. Third basically because it's divided into three parts, so it's called as incisal third. Now this part is called as middle third, present in the middle, so called as middle third. And finally this part is called as cervical. Cervical because it's present terminally close to the cervical area of the tooth, so it's called as the cervical third. It's called a cervical third. Now the crown can also be divided vertically. Now talking about its vertical divisions, it is divided like this part and this part. Now the portion of a crown that is closer to the midline, as we talked before, like for example in this case this part, is called as the mesial surface or mesial third, and this part, this in middle, is called as middle third, same as before in horizontal division. And now this part that is away from the midline is known as the distal one third. So crown can be divided into two ways. We can divide it in vertically as well as horizontally. Horizontally with the division like this. Okay, now talking about the division of the root. Root can only be divided horizontally. There is no vertical division in it. So dividing the root into three parts, this and this. Now this part is also called as cervical, same like crown. Now this in the middle area is called as middle one third, same like in crown. And this closer to the apex is called as apical one third. Now it's closer to the apex, so that it's called as apical one third. So this was how you divide a tooth into different parts for our convenience, so that we can call it as a term, so that we can, it helps us in procedures and also in defining a tooth. So that's the whole reason of making this division of a tooth. Crown can be divided horizontally as well as vertically, and root can only be divided horizontally in this, and we use the following terminologies to call it. The last topic that we will cover in this video is what are line and point angles. So first we'll talk about what is a line and point angle. Line angles basically it's that part where two surfaces meet at a junction. So for example, if I were to draw an incisor like this, the crown of an incisor, now you can see at this point the incisal surface, this surface is meeting the mesial surface. So this surface meeting this mesial surface is called as mesiolabial angle. And you can do this for any part of the incisor where two surfaces are meeting. For example, you can also use the distolabial angle over here. You can also use the linguo-incisal angle. You can, this is the incisor surface, and at the back it's the lingual surface, so you can use the terminology linguo-incisal angle. It's basically any surface where the two surfaces are meeting at a junction, creating a point angle. Now talking about point angle is formed by junction of three surfaces. Like in the case of a line angle, it was two surfaces. For point angle, it's three surfaces. So let's see how it works. Now in this picture, you can see a rough drawing of a incisor. It's drawn in a 3D structure, so you can see the point angle. This particular area, which I have marked with blue, you can see three surfaces are meeting. This surface, you can see this surface, and then finally you can see this surface. This I have drawn with black. Now at this particular point drawn with blue, you can see red, green and black. These all three lines are meeting at a point. Now at this particular point, three surfaces are meeting, so we call this as mesio. Because of the mesial surface, we use the term labio because of the labial surface, and incisal because of the incisal surface. Now mesio, labio, incisal angle, because three surfaces are meeting. You can do this for pretty much any surfaces where any junction where three surfaces are meeting. For example, you can also call it as disto-labial incisal angle, where this distal surface, this incisal and labial surface is meeting at this point. You can call it as disto-labial incisal angle. You can also use this term for posterior teeth. You can call it as mesio-linguo-occlusal point. Basically, occlusal instead of incisal, as we have talked before. For the top view, instead of incisal in posterior teeth, we use the term occlusal view. So for line angles and point angles, for line angle, any two surfaces where they are meeting at a junction, you use the term line angle, and using the surfaces of the tooth, like I told you before, you can form any angle and name it according to their location. And for point angles, any surface where three surfaces are meeting at a junction, you use the term point angle and you name it according to the surfaces that are meeting at this point where three surfaces are meeting. So this was all about introduction to dental anatomy. This was pretty much very basics that we talk about in dental anatomy, and this amount of basic stuff you have to know when you will start tooth morphology, as we will do in our further videos. In introduction to dental anatomy, we talked about what is dental anatomy. Then we talked about different types of teeth that are present in the oral cavity, the primary and permanent teeth. We talked about numbering system. Then we move on to crown and tooth. Then we talked about surfaces of the tooth. We also talked about basic definitions that are when we use in dental anatomy. We talked about divisions of the teeth, and finally we talked about what is line and point angle. So I hope you find this introduction to dental anatomy useful. And if you want to review the previous video where I talked about other sections of the introduction to dental anatomy, which I haven't covered here, I have covered in part 1. You can check out that video in description. So I hope this video to introduction to dental anatomy was helpful to you, and if you like this video, please like, share and subscribe. Thank you very much. See you guys in further videos. Thank you.